Welcome back, Focus Learners. I am so pumped to have you here for part 5 of our 100-part CPC exam explainer series. Today, we're unlocking the ultimate masterclass toolkit. Before we get into it, make sure to like, share, and subscribe to Decode Healthcare with Harshal so you never miss an update. Let's do this. Okay, so what's on the docket today? We're setting you up with a highly actionable toolkit. We're going to breeze through directional terms, the anatomy link method, the topography ladder, eponym triggers, and cap it off with a 5-step parsing protocol to help you confidently crack those complex exam scenarios. Let's jump right into mastering directional and spatial terms. Be honest, have you ever stared blankly at a practice test and totally mixed up similar-sounding anatomical terms? Yeah, you're definitely not alone. That is exactly why we're starting right here. I want you to really visualize the human body as we map these out. These spatial terms, they're basically clinical adjectives, and they absolutely drive your code specificity. Get these wrong and your coding goes off the rails. First up, proximal versus distal. Think about your limbs for a second. Proximal simply means closer to the trunk or the point of attachment, like your shoulder. Distal, that's farther away, like your fingertips. Nailing down this limb distance is absolutely vital when you're coding things like extremity fractures, tendon injuries, or vascular descriptions. Next, let's talk vertical position. Supra means above, and sub means below. Just associate supra with superior. It sounds super simple, right? But if you accidentally flip these prefixes in your head under test pressure, you could literally map the completely wrong anatomical region or procedural depth. Then we have intra-articular versus extra-articular. Now, intra-articular means you're hitting the target right inside the joint space capsule, while extra-articular means you're outside that joint space. Don't fall into the trap of assuming both just mean joint-related. Pinpointing whether a procedure is inside or outside the capsule completely changes your surgical approach and the complexity codes you need to select. And finally, a classic exam trap, mixing up a condyle with an epicondyle. A condyle is the rounded joint surface right at the end of a bone. An epicondyle, on the other hand, is the projection above that condyle where the tendons actually attach. If you mix up the joint surface with its tendon attachment site, well, you're going to target the wrong anatomy entirely. Moving on to the anatomy link method. This is a real game changer. It's going to completely flip how you decode unfamiliar clinical terms, so you aren't just relying on pure brute force memorization. Whenever you face a massive, intimidating clinical word in a question stem, I want you to instantly ask yourself 2 fundamental questions. Number 1, what structure are we talking about? And number 2, what is actually happening? Is it a condition or is it a procedure? Let's put this under the microscope with a practical example. Take the term hepatomegaly. First, grab the root, hepato, which means liver. Then, grab the suffix, megaly, which means enlargement. Put them together, and you instantly get enlarged liver. Boom! You've got the anatomical site and the condition in one single swoop. All right, let's climb the topography specificity ladder. This concept perfectly illustrates how tiny anatomical descriptors carry massive coding consequences. Watch how we step up this ladder. Level 1 is super vague, lesion on arm. Level 2 adds a segment, lesion on right arm. Level 3 gives us a specific surface, posterior right upper arm. And then level 4, that's high precision, 2-centimeter lesion, posterior right upper arm near elbow crease. Extracting these ultra-specific details from the documentation is exactly what stops you from falling back on those vague, unspecified codes. Okay, eponyms as translation triggers. Take a deep breath here because this should actually ease your exam anxiety. You absolutely do not need to memorize every single physician's name in the medical dictionary. You just need to know the specific anatomical region they trigger. For instance, when you see Coley's fracture, just treat it as a rapid shortcut. Your brain should immediately translate that to a distal radius injury pattern. See McBurney's point? That instantly triggers the right lower quadrant, specifically a landmark for pendiceal tenderness. See? They aren't roadblocks, they're just translation shortcuts. And that brings us to the ultimate tool, the 5-step scenario parsing protocol. This is the climax of today's explainer, where all of this foundational knowledge gets put to the test for exam day. I want you to get in the habit of rigorously scanning your operative notes for 5 specific variables before you even glance at the multiple choice answers. Seriously, if you lock this in, the correct code will basically reveal itself to you. Here is the rapid-fire breakdown. Step 1, where? What's the anatomic site? Step 2, which side? Laterality is absolutely critical because it dictates if you're using your RT, LT, or 50 modifiers. Step 3. How deep? What's the surgical approach or tissue layer? Step 4. What happened? What's the actual root operation here? Excision? Repair? And finally, step 5. What's the nuance? Are we dealing with acute, chronic, or displaced? As promised, here is your one-page visual summary. Go ahead and take a quick screenshot of this masterclass cheat sheet right now. It beautifully recaps everything we just covered: directional terms, the anatomy link method, the topography ladder, eponyms, and our 5-step parsing protocol. Keep this tucked away for your practice sessions. You know, true coding mastery doesn't come from just memorizing lists of numbers. It comes from deeply understanding the anatomical story the provider is telling. So what hidden stories will you uncover in the skin layers next time? Join us for part 6, where we are going to decode the integumentary system, diving into skin layers, depth, and wound documentation. Make sure you're subscribed and keep decoding.